So I'm going to talk to you a little bit about general maintenance. You're going to go over to your computer. You're going to press your instruments, machine I'm using, which is my Catalyst. I'm going to go to quality control. And it's going to pop up here with some lot numbers. You can actually look directly on your vials and it's going to give you the numbers that you need. You need to pick the appropriate one that you need to use, so it's the appropriate expiration date. You actually are going to click it and then you're going to run your quality controls. This will kick back over here to my machine where it's going to ask me to prompt in order to run everything. I have my little quality control clips that come from IDEX, and once I have my solution made up, I'm going to install it in here. So that's for quality control. For cleaning wise, these doors actually open. You can pull them up right from here. When you're cleaning on the insides, you want to make sure you use only alcohol prep. Don't use anything else that has dust, because you can actually really mess up your machine if you use anything other than what the company says to use. If you have any problems or anything, it gets stuck or you're unsure, because a lot of the times with this machine, doors will get stuck. So it's really important that you call the company and they help you walk yourself through it. Other general things on this machine is we have our little door here. In our door, we'll have tips, and these are going to be used when you're actually running your samples. You want to make sure these are full. If they're not or running low, it will actually pop up on your screen saying that you need to add tips. Once it's full, you close it and that actually will go away. Other things, if your drawer down here, once your samples are done running, all your slides and your tips are actually going to fall in this little container down here. It's really important to check it after every run and empty it, but sometimes I know you get busy and you don't, but it will alert you if this does get full. So checking that, actually when you put it back in, it's going to pop up on the screen and ask you again, is the waste drawer empty? I'm going to click yes. So then that way it processes through. On here, also under my tools, it talks about cleaning the analyzer, and you actually order that from the company and you put it in a special cup and it processes it through and cleans your machine. If you have any other issues or pops up with alerts, a lot of things on here will actually walk you right through it. It's kind of easy and pretty self-explanatory, but again, if you always have questions, it's always important to call the company rather than messing with your machine. For this video, I'm going to show you how to do an ELISA snap test. For this test in particular, I'm going to do a 4DX, which is a heartworm test, includes some tick disease tests and a Lyme disease. What you need is your test. We like to recommend taking it out of the fridge and coming to room temperature before you run it. So you have your test, you have your blood sample, and then you have your conjugate. So for the blood, you're going to do 3 drops, making sure your pipette is straight up and down so you have equal drops. So 1, 2, 3. Then you're going to do 4 drops of conjugate, again keeping it straight up and down. 1, 2, 3, 4. Then you're going to close it and then slowly rock it back and forth, mixing your sample for testing. Next thing I'm going to do is, if you have a machine, you can do it this way or you can do it manually if you don't. With the manual version, I would pour my sample right on top, let the sample flow through. The minute I see a flash of blood right here in this little circle, I'm going to snap it and set my timer for 10 minutes. For my machine, I'm going to press my patient's name, which is Kelsey. Check her, and then hit the check mark, and it's going to tell me to insert my snap. So I'm going to go ahead and take my sample, pour it all in, and then insert it in my machine. And once the blood flows through here, the machine will actually snap it itself, and then it takes about 10 minutes, and then I'll get my results. So for our next video, I'm going to be showing you how to do a fecal flotation. So what you're going to need is you're going to need 2 grams of stool. So what you do first is you're going to take a little piece of your stool, put it in your cup. Then you're going to take your fecal solution. We use zinc sulfate. Pour some in the cup. And then you're going to mix it all together. Once it is fully mixed, you're going to then take some sort of strainer, or you can use gauze as well. and strain out all the extra fecal matter. Then once you have your solution, you're going to grab your fecal tube, pour in your stool almost fully to the top. Set it over here so it doesn't spill. Then you're going to take some of your fecal solution again, pour it on top until you get slightly over the top where you form a meniscus. Then you're going to take your cover slip, set it on top of your sample, and then let it sit for about 10 to 15 minutes, and then you're going to go ahead and read it. So once your sample has sat for 10 to 15 minutes for your fecal flotation, you're going to carefully remove your cover slip onto your microscope slide. Take this over to your microscope. Be ready for examination. We usually start at 10 and then we move up to 40 to see some parasites. You want to make sure your light is dim so you don't blow through your eggs. Once you're done reading your sample, you go ahead and give the doctor your results. So for our next video, I'm going to be showing you how to do a fecal flotation with sedimentation. So what you're going to do first is you're going to have about 2 grams of stool. Put that in your cup. Take some of our fecal solution, which is zinc sulfate. Going to then mix the stool thoroughly. Once that is mixed, you're going to take a strainer or a gauze, whatever you have available, to separate the excess fecal matter. Then you're going to take your sample, pour it in your sample tube. You're going to want to make sure you get as close to the top as possible. And then you're going to take it over to your centrifuge, making sure you have another tube to level out the centrifuge. Then you're going to place in your centrifuge, close. For this centrifuge in particular, we set it for the fecal setting. Then we're going to go ahead and let it centrifuge for about 5 minutes. And the sample is complete in the centrifuge. You're going to go ahead and take it out. Bring it over here. Then you're going to take some of your fecal solution, which again is the zinc sulfate, and you're going to put very slowly enough in order to form a meniscus where it's slightly over the top but it's not pouring off. After that is done, you're going to then take a cover slip, place it on top, then set your timer for 10 to 15 minutes and then it'll be ready to read. So once your sample has sat for 10 to 15 minutes, you're going to carefully take your cover slip, place it on top of your slide, then take it over to your microscope. It is ready to be examined. We start at low power 10 and then move up to 40. And once you have your results, go ahead and give them to your doctor. So for our next video, I'm going to be showing you how to do a direct smear for our fecal. First thing you're going to need is a microscope slide and some saline. You're going to take your saline and put some drops on your slide first. Then you're going to take some of your fecal matter and mix it with the saline, kind of equal amount of saline and stool. You want to mix it enough where it is homogeneous. Once it is mixed, you want to kind of spread it throughout the slide, thin enough where you're going to be able to read it, removing any excess fecal matter so it's not thick so you don't miss any parasites. Once that is done, you're going to take a cover slip, place it over your sample, and then take it over to your microscope for viewing. Again, you want to make sure your light is pretty dim. We're going to start off at our 10x power and then move up to our 40. Once you're done viewing your stool, go ahead and give the doctor your results. So for our next video, I'm going to be showing you how to do a sedimentation for fecal. First thing you're going to need is about 2 grams of stool and your cup. You're going to go ahead and put the stool in the cup, and then you're actually going to mix it with some tap water. Go ahead and mix your sample thoroughly, trying to get all the big clumps out. Once that is done, you're going to go ahead and strain your sample, so getting any of the excess stool out. Then you are going to pour your sample into your sample tube. Then take your sample, take it over to your centrifuge. So we can go ahead and spin it down so we can get our sediment at the bottom. Close our centrifuge, and then we're going to go ahead and set it for 5 minutes. If you don't have a centrifuge available, you can also have it sit for undisturbed, not touching, for about 30 minutes. So after your stool has spun for your 5 minutes, you're going to pull it out of the centrifuge. You can either use a pipette or you can actually pour out the supernatant, because we want the sediment that's at the bottom. Try not to disturb your sediment. So I'm going to pour it out in my sink. I'm going to grab a microscope slide. I'm going to use a pipette to get a small amount of stool. Place it on my slide. Then grab a cover slip. Place it over my sample. Then take it over to my microscope to view. So again, you're going to start at your low 10 view and then move up to 40. And then after viewing your microscope in your sample, you're going to go ahead and report your findings to the doctor. In this video, I'm going to show you how to do some lab work on your in-house equipment. For this particular one, I'm going to do what we call a senior screen, which is actually a Chem 15, so checks liver, kidneys, a CBC, so checking red blood cell, white blood cell count, platelets, and a thyroid, so a T4. So what you're going to do first is you actually come over to your computer, click on your patient, and then pick what test you want. That information is going to transfer over to here. So I'm going to find on my equipment my patient's name, which is Kelsey. I'm going to hit her name, and I'm going to hit run. Next thing it's going to ask is what kind of test I want to run. So I want to use my ProCyte for my CBC and my Catalyst for my chemistries and electrolytes and my thyroid. So what I'm going to do first is I'm going to select the ProCyte and the Catalyst. Then I'm going to come over here, press the open button. I'm going to invert my CBC about 10 times, very, very slowly, not shaking it so I don't interrupt any cells. Once that is done, I'm going to insert it in my machine. Now I'm going to come back here, I'm going to hit run. An alert's going to pop up, and it's going to ask me if I did all these things like invert. So yes, I did, so I'll press OK. Then I'll come over here and press my start button. And then as my CBC is cooking, I'll come over here to my Catalyst to do my chemistries and my electrolytes and my thyroid. So first thing I do is wake up the machine. It's going to ask me my patients, so it's Kelsey. And then I'm going to hit select. It's going to ask me what type of sample I have. For this particular blood work, I'm using a whole blood separator. You can also use plasma or serum, doesn't matter. Whatever you do, just pick the appropriate thing so the machine knows what you're running. Next thing you're going to do is you're going to get to your slides. We keep our electrolytes and chemistries in our freezer. So I'm going to grab my electrolytes and my Chem 15. Next thing I'm going to grab is my thyroid, which we keep in the refrigerator. So once I got all those out, I will press the whole blood. Then I'm going to hit next. I'm going to swivel my whole blood, making sure it's mixed evenly. Then I'm going to put my sample in. Next, I'm going to open my lights. I'll pop those, spread them so they're not sticking. And insert those in my machine. Next, I'm going to take my Chem 15, do the same thing. And then last, I'm going to insert my thyroid. So the thyroid, the T4 comes as an individual slide. So I'm going to open it up. And it comes as the individual slide, like I said. So I'm going to open it up, being careful not to touch the circle, where it actually is going to soak up the blood and read. And insert my slide here. Also with the T4, it comes with this. So I'm going to open where my tips are. And I'm going to, it only fits one way, so there's no way to inappropriately put it in. So I'm going to put that in, close it. Once I have everything ready to go, I'm going to hit run. And then I'm going to wait for my results. Once your chemistries and your CBC and all your blood work is done, the results will either print out on your machine, something looking like this, where I'll have all your results, all the values, which are what the normals are. If it doesn't, you can actually come over right to your machine and select the patient and then hit print, and it will actually print it out. Or in some systems, they actually will transfer right to their patient clipboard, so right to their file, and actually be saved in the computer. Once you're done, go ahead and give your results to your doctor, and then they can evaluate what's going on with your patient. So for this video, I'm going to show you how to properly get an ear swab from a dog. So your first thing you need is a cotton tip applicator. You're going to lift the dog's ear up, stick your swab in as deep as you can go while swabbing, and then pull out. And if the dog had an ear infection, you can kind of see this one has a little bit of debris, but you're going to set that up there, and then do the same thing with the other ear. Insert the cotton tip all the way in. If the dog's head is down, it's a little bit better because you can get a little bit deeper. Swab, 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 and then pull it out, and that's it. So for the next video, I'm going to show you how to do a swab for your ear cytology and properly staining it and putting it on your slide. So you want to take your swabs, and from the right ear, you want to put the right swab on the right side, rolling gently so you're not getting too many clumps. Keeping the right side with the right ear, then taking your left ear, putting it on the left side, again rolling. The next thing you're going to do is you're going to grab a lighter, and you're going to what we call a heat fix. So you're going to take the lighter and swipe it under your slide a couple times, making sure you're not singeing your sample. The next thing you're going to do is come over to your Diff Quick stain. You're going to insert your slide, leaving it going up and down for about 10 to 15 seconds. After your first, you're going to move over to your next stain, again for 10 to 15 seconds. After your second stain, which is the orange one, you're going to take it over to your sink, and you're going to lightly rinse. Then going next to your last stain, which is the purple, again for about 10 to 15 seconds. Once that is complete, again, you're going to go over to your sink, lightly rinsing off all the excess stain. Then taking a paper towel or something. You can either air dry them, or you can kind of pat it dry. You want to be careful not to wipe off your sample. A lot of the times you can just air dry it so you don't wipe off your sample. After you're done with staining, you're going to take it over to your microscope and evaluate your sample. You want to start at the lowest power on your microscope, which is the 10 power. Your light needs to be pretty bright so you're not blowing through any of the organisms. Make sure your sample is face up. Put it on your microscope and evaluate. You should be seeing, if there is any debris, you should be seeing small purple staining on here, which is usually some sort of debris that you got out of the ear. After you're done with lower power and you find your next source, you're going to move up to 40. Again, finding your little sample to evaluate. Once you find that, you're going to go to our 100, which is our oil immersion. So you're going to need your immersion oil. You put a small drop on your sample, put it on oil, and then slowly start looking for any debris in your dog's ears. If you see anything, you should just notify your doctor right away. Alright, so for our next videos, we're actually going to do a necropsy. First important thing is you have some protective gear on. You want to wear a hat, a mask, a gown, and gloves. And then we're going to go ahead and jump into it with the doctor.
So first we take a look at the whole animal so that we know what we're dealing with. We know that this is an 8 to 10-year-old bunny rabbit that presented today for hind limb paralysis. She also had on presentation a creamy eye discharge. We look at the eyes on the outside and note no obvious abnormalities, which was confirmed at the physical examination as well. The ears were examined with an otoscope and found to be normal on presentation. We're not able to look at bunnies' mouths very well because they object, so we're going to take a look at that She's got really nice teeth here, no evidence of dental issues on her front teeth. And then bunnies are hard to see into their back molars. When they're awake, it's almost impossible. They've got these giant tongues that get in the way. But we're going to look at her mouth to see if there's any reason that her oral cavity was an issue. We examine the rest of her. She's thin. We can feel her ribs. Go ahead and feel there. So we confirm that she is kind of on the thin side. Maybe there's some malnutrition issues or GI issues that we need to address. We have confirmation of urine impacted around her bottom, her perineal area. So her coat is otherwise in great condition. Use a scalpel blade to do this necropsy. It just is much easier to clip them. And we're just going to go ahead and make a midline incision from her pelvic bone all the way up to the top of her sternum. We want to try to find midline just because it's a nice place to start. Looks good. So you want to notate the calcium nodules in the subq fat, and we've got a yellow, cloudy subq fluid. And if we start at the chest, we're going to notate, here's her diaphragm, very thin, wispy, nearly almost no muscle in the middle. That's normal. Very little change here in her chest. So we note her heart right here, and we've got a bunch of big vessels in there. We want to try not to rupture so that we can see, because we've got our lungs here. They're nice and soft, so that's normal. She's got a little bit of discoloration here. Kind of a mottled redness on the edges of her lungs. This is probably age fibrosis here that we're seeing these sort of nodular appearances. So that's good. I'm going to take a little sample of the lung tissue. That's what I would do if we were sending this off and really worried, you know, we have a group situation where several bunnies have died or something. I like to not really apply instruments to the tissues that I'm going to take off because I don't want to get artificial smash injuries. So I'm a little concerned about this sort of various colors. I'm going to take a big wedge. And we'll send that into the lab. That came from her left caudal lung lobe.
So after getting a sample from the doctor, she put it in our formalin jar. We're going to properly label it with the patient's name, date of birth, today's date, where she received the sample, and of course the doctor's name. Make sure it's completely sealed before you send it off to the lab.
But now we're going to go ahead. Everything else looks pretty normal up here in the thorax. We're going to go to the abdomen. This is her liver. She does have a couple little spots on her liver. Again, these, because she is a fairly old bunny, she had a little adhesion to some mesentery there. That's interesting. So this looks a little white, maybe a little pussy. I'm going to take a sample of that. That would be very interesting, indicating that she may have had an infection here as well. So there goes her liver, left liver lobe. We see her gallbladder here, which is quite full, probably because she hasn't been eating well, I would say. This is her stomach, located left cranial abdomen, also not very full. Now I'm going to follow the stomach down through all the intestines. So it's very nice. You can usually take and kind of pull everything over to one side and kind of flop it out. So you can see now where the stomach goes into the pylorus, into the duodenum, and we're going to chase this, we call it. And we're just going to feel all the way down. So here we have some lymph nodes associated with the intestines, and these are normal in a bunny. So I don't like the look of that one though. That one's sort of ugly. Let's come back and make a note that we're going to come back and take one of the small intestinal lymphatic nodules. She's got a big one here. All the cecum here, this whole dark brown structure is a cecum. This is where they do a lot of the fermentation for all the fiber that they eat. This is a huge part of the intestine, as you can see. Okay, so that all looks fairly normal. So this is attractive. Now we've had this thing sitting in front of us while we've been paying attention to the intestines, because we're just, you have to be methodical about it. So we've been doing all of this stuff, and the intestinal tract looks good, although it's kind of empty. Ovaries are multinodular and creamy white in color. Which is abnormal. I'm going to follow this. Here's your uterus, and then we've got this thing. What is this? See this thing? Mm-hmm. What is this? Seems to be hanging off the reproductive tract somewhere, and we seem to be having this reproductive issue. So I'm not happy about that. That looks like, I mean, it's obviously a tumor. Yeah.
So once your necropsy is complete, you're going to take your biopsy samples, make sure again they're properly labeled, all your notes throughout the whole thing, and transfer them over to the doctor so she can write everything up. So the next thing I'll be talking about is how to handle a rabies suspect. The first thing is who can handle the rabies suspect: a licensed veterinarian and a technician who has been certified, as well as been vaccinated for rabies. For protective gear, you want to make sure you're wearing a mask, protective very thick gloves, a gown, and any other protective eyewear as well. For sample, you're going to they actually remove the animal's head. Unless it's a smaller patient like a bat, they actually send the entire animal. You're going to send your sample to your local state lab in a sealed container with a biohazard label on it with the patient's name, age, breed, sex, veterinarian. Your sample should be refrigerated, not frozen, because that's very, very important for the study. For the rest of the remainder of the animal, it could actually be cremated instead of buried because of the potential of another animal getting to it if the animal does actually have rabies. So we're going to be performing a vaginal cytology. This is Molly. She's actually a non-spayed female. The first thing we're going to do is we want to put her up on the table. It's a lot easier. The doctor is next going to wash around her vulva with a dilute betadine solution. Just to make sure everything's clean so we're not picking any outside debris.
You can hold her tail.
Yeah.
So isolate the bottom of the vulva. Occasionally you might need to clip some of the hair coat, but thoroughly clean the vaginal opening. I prefer dilute betadine to Chlorhex. A little bit toward you. Just very gently insert your swab at about a 30-degree upward angle into the vulvar vault. Kind of roll your swab around to pick up enough cells and out. And we'll roll that onto a slide for cytology.
Alright. So once we've collected our vaginal cytology sample, we're going to grab our swab and our microscope slide. We are going to gently take our swab and roll it on our microscope. Once that's done, we're going to go ahead and stain it in our Dip Quick Stain. Do the first one, allowing it to be for about 10 to 15 seconds. Next, we'll go to our next one, again for 10 to 15 seconds. And we're going to lightly rinse and last into our purple stain for again 10 to 15 seconds. Then again, lightly rinsing. And then you want to set it and let it air dry until it's completely dry. So patting dry so we don't wipe away any of our cells. So once our slide is dry, we're going to take it over to our microscope to determine what type of estrus our patient is in. We are going to start off at our low power, which is our 10x, with the light fully up. Going ahead and looking for any of organisms in here. Next, we'll move up to 40 so we can get a larger view. Again, just adjusting so we can focus. Last, we're going to then go up to our oil immersion. We're going to take our oil, place it on our slide where our sample is. And then go to oil, again, adjusting and focusing as needed in order to find our cells. Now we're gonna go ahead and view it. So while looking in my slide, it looks like I have some intermediate and some parabasal cells. This sample doesn't look very exciting. So most likely our patient is actually in anestrus, so she's not currently in heat. Doesn't look like we have any red blood cells. You want to go ahead and view the entire slide, making sure you're viewing everything just in case you don't miss anything. So after viewing our slide to determine, it looks like our patient is in anestrus, so she's currently not in heat at this time. All right, so now I'm going to talk to you about the 4 stages of estrus. The first one is going to be anestrus. This is when the reproductive system is completely at rest. On microscopic exam, you're going to see intermediate and parabasal cells are predominant in smears taken during anestrus. There are superficial cells are absent or only very small in number, so you won't see much of them in your slide. Also, neutrophils and red blood cells may or may not be present in your slide. The next one is going to be proestrus. This is the follicular phase. You're going to see an increase in estrogen as the follicle develops, the uterus enlarges. So basically they're starting to go into heat. On microscopic exam, you're going to see a mix of parabasal, intermediate, and superficial epithelial cells. Gradual shift to all those superficial cells, red blood cells present in large numbers, and a large number of bacteria are often present as well. Your next one is going to be estrus. This is actually when they're going through ovulation, so their estrogen has decreased, their progesterone increases. On microscopic exam, you're going to see predominantly superficial cells, nearly all anuclear. You're going to see nearly anuclear, nearly all cornified and keratinized. Virtually no other cells are going to be seen, and then bacteria are usually attached to the superficial cells, and that's very, very common. And the last one is going to be diestrus. You're going to see a marked decline of superficial cells. You're going to see a reappearance of the intermediate cells and the parabasal cells. The cellular change can occur within 1 day. So for my next video, I'm going to show you how to do a skin scraping. The things you're going to need are some microscope slides, mineral oil, and a blade. You can use a 10 or 15 blade as long as they're dull, because that way you don't actually cut through the skin when you're doing your skin scraping on the patient. So what you're going to do first is you're going to take your microscope slide, a clean one. You're going to then take your mineral oil, put a dot of mineral oil on your slide, then taking your blade and rubbing it through the mineral oil before you go over to your patient to get your sample. On a patient that is coming in for hair loss or anything like that, where you want to scrape is where they're actually having the hair loss. Since she doesn't, I'm just going to pick a spot on her. So what you're going to do first is you're going to pinch your skin, take your blade, and you're going to rub it downwards on the hair, scraping enough, gently but kind of rough at the same time, where you're not actually slicing the fur. You want to get deep enough, hold on baby, until you actually see some blood, because if you are going to find anything, that's where the mites like to hide, or near the capillaries. Right, baby. Alright, so once you're done scraping, you get that little bit of blood. You're going to take your sample over to your microscope slide. And even though, yes, it has hair, you're going to then put it in the mineral oil, making sure you have a good enough sample. If you don't, you can always go back and get some more. Next, you're going to grab a cover slip, making sure you only have one, and putting it over your sample, then taking it over to the microscope and reading it. You're going to start off at your lowest power on your microscope, lining up your tube. You're going to slightly dim the light, but not a lot. Then you're going to evaluate it. You're going to see in your sample, of course, hair, since you did the scraping through the hair. Other things you might see are red blood cells, because you had to go down to the capillary in order to get anything like mites. A lot of times you'll see a lot of air bubbles or extra debris. but you're looking for things like mites, like Demodex or mange or anything like that. It's very important to evaluate the whole sample because sometimes even just one can be a positive result. Then once you're done evaluating your sample, take it off and then turn it off and then give your results to your doctor. So for our next video, I'm going to show you how we do our cross-match agglutination. I already have drawn blood from my patients. So what I did is I drew blood and I separated it into our serum separator and our EDTA. I have one sample from each patient, from our donor and then our recipient. The first thing we're going to do is allow our sample to sit for 20 minutes. So now that my samples have sat for 20 minutes and clotted, I'm going to go ahead and centrifuge them. We're going to centrifuge them at a 3,500 RPMs. Close my centrifuge. I'm going to set it for my 3,500 RPMs and then go ahead and start my timer for 10 minutes. Alright, so once our samples have completed centrifuging and spinning down, we're going to go ahead and take them out. Your serum should be separated now from your red blood cells. So what I'm going to do is, this is Carson, who is my donor, on my pre-labeled clear tube. Take my sample. Being very careful not to interrupt my red blood cells. And the cap back on both of them. I'm going to set them aside. I labeled Carson again, that's my donor. And I'm going to get a new pipette and do the same thing with Riley, going to be my recipient. Once that's separated, I'm going to set those aside. I am going to now spin down my lavender tops for my EDTA plasma. Set it for my 3,400 RPMs, so that's already done on here. I'm going to go ahead and set it for 10 minutes and let that spin down. So now that my EDTA lavender tops are done spinning, I'm going to go ahead and remove one at a time. So my first one's going to be Riley. I am going to go ahead and also grab another tube that's going to be with no additives that I'm going to put in my red blood cells, or my erythrocytes. So the first thing I'm going to do, I'm going to decant all of my EDTA plasma. Again, being very careful not to disturb any of my erythrocytes. Alright, so once that's done, I'm going to go again grab my previously labeled tube for Riley. Take the lid off, and then again I'm going to go ahead and take 1 to 2 drops of my erythrocytes that are at the bottom. Place them in my tube. So 1, 2. Next I'm going to take sodium chloride 0.9% or saline, and I'm going to fill the rest of the tube with that. So this is what we're calling our washing our erythrocytes. Once that is done, I'm going to put the cap back on. Then I'm going to gently mix very carefully. Alright, so after I gently mix it, I'm going to set this one aside for a sec and do the same thing with Carson's. Again, decanting the EDTA plasma, being again careful, very careful not to interrupt our red blood cells. Once that is done, just like for Riley, I'm going to take 2 drops of my erythrocytes, place them in my new tube. 1, 2. Then I'm going to take my saline and fill back up. Gently, again, mix thoroughly. Again, this is what we're calling washing our erythrocytes. Once that is mixed, I am going to put these in my centrifuge. Again, being equal. Close, set my speed for 3,400 and spin for 1 minute. Okay, so now that it's spun down for a minute, we're going to, again, repeat the same thing that we just did. So I'm going to take Carson. Again, I'm going to decant my supernatant. Alright, once that's done, again, I'm going to repeat, so I have Carson's labeled. I'm going to take 2 drops of my erythrocytes, then mix in some of that sodium chloride and saline. Gently mixing, just like the first time. Okay, then I'm going to set this one in the centrifuge. And I'm going to grab Riley, doing the same thing, decanting my supernatant. Once again, I'm going to take 2 drops of my red blood cells. 1, 2. And my saline. And the cap. And mixing gently. Sticking this in my centrifuge, and again, putting my RPMs at 3,400. Setting for a minute and letting it spin down. I'm going to repeat this one more time, and then I'm going to move on to the next thing. So my third and final wash is finished. So I got Riley first. So just like before, I'm going to decant my supernatant, and as you see, it's pretty clear, so that means they washed really well. Now that that is done, I'm going to go ahead and make my erythrocyte suspension. So first thing I'm going to do is I need 0.02 of my packed erythrocytes. So I'm going to go ahead and get those, put it into here, 2. Then I'm going to take 0.98 of sodium chloride, infuse that in here, replace my lid, and then gently mix. And then I'm going to set this aside to use in a minute. So that's Riley. I'm going to go ahead and do the same thing with Carson. Decanting my supernatant. Then, just like with Riley, I'm going to extract 0.02 of my packed erythrocytes, and I have my pre-measured 0.98 of my sodium chloride. I'm going to gently mix and set that aside. And then we are going to go on to our testing to see if they are a match. All right, so now it's time to do my testing. So for my major cross match, I'm going to take 2 drops of my recipient, which was Riley, of the serum, and then 2 drops of my donor, which was Carson's erythrocyte suspension. So I'm going to go ahead and do that. So 1, 2 of the serum. And I'll take 2 drops of Carson's erythrocyte suspension. Again, 1, 2. Place back on the cap, and then I'm going to gently mix. Okay, so now I'm going to do my minor cross match, which I'm going to do 2 drops of my donor's serum, and then 2 drops of my recipient's erythrocyte suspension. So I'm going to go ahead and do that, and I'm going to put them in a new tube, so again, just like I did for the major cross match. And I do have these labeled with the minor and major cross match. It's very important so you remember which ones you're doing. So just like my major, I'm going to mix these gently. So you also want to have what we call a control. So we're going to check for auto agglutination. So what I'm going to do is have 2 controls, one for Riley and one for Carson. So I start with Riley. What you're going to do is you're going to take Riley's own serum and do 2 drops into a brand new tube. Again, I have this labeled as Riley's control. I'm going to do 2 drops. And then 2 drops of Riley's own erythrocyte suspension. 1, 2. Place the lid back on. And again, just like everything else, I'm going to gently mix those together. So just for like Riley, I'm going to need to do Carson, my donor's control as well. So again, 2 drops of Carson's serum and 2 drops of his erythrocyte suspension. 1, 2. Placing the lid back on and mixing gently. So the next thing I'm going to do is I'm going to place all my tubes that I've done already on a rack. I'm going to gently rotate them to mix them a little bit. I'm actually going to have them incubate for 30 minutes. So I'm going to set my timer for 30 minutes. And then I will be back. Now that my samples have sat and incubated for 30 minutes, I'm going to go ahead and put them in the centrifuge and set them for the 3,400 RPMs and spin them down for a minute. Okay, so now that I have spun my samples down for a minute, I'm going to pull them out. So I'm going to flick them a little bit so I mix. What I'm going to be looking for is any hemolysis. In my controls, I should have no hemolysis because they came from the same recipient and donor. And looks like I don't see any active agglutination, so I'm going to go ahead and look at them under the microscope. So I have my microscope slides already labeled major and minor. Do a drop of my major and a drop of my minor. A cover slip and place those on top. I'm going to take them over to my microscope and ready to view them. I want to examine them on low power. I also want to lower the condenser to increase the contrast. And if I do have agglutination, I should be seeing small, kind of grape-like clusters. It doesn't look like I'm seeing any. Don't see any, so then I'm going to look at my minor. Same thing, lowering the condenser, dimming the light so I can look for my clumps. So after reviewing my samples, it looks like my patients are actually compatible for cross-matching.